And definitely don't ask me about your bin, because, as you know, that is a city council matter. It's nothing to do with the county council. So structure is very important for us. What I was going to briefly talk about, and what I was asked to talk about, is try and set some of where is Cambridge going in context. So that's my brief, if you like. What I did initially is dip into a report about the Cambridge cluster at 50. Written by someone called Jill Tufnell, who was one of my predecessors at the County Council, but she was working in other guise as a consultant for SQW. That proves there is life after local government. Now, what that report very clearly says is what the main things driving growth and change and development within Cambridge. We're talking about supporting the tremendous amount of technology-based businesses and that developed in the area, the Cambridge phenomenon. We're talking about supporting and the growth of the wider research community, particularly in relation to the university. And beyond that, Cambridge, is the city. It's got the city centre economy, and we've got that developing. It's an international visitor destination for all the reasons I think Ben outlined, and really vibrant heritage that the city's got. And when this report was written, we were a regional hub for the public sector. People know the public purse constricted quite a lot, and we lost the government office for the Eastern region. Some of the other main government areas have shrunk quite considerably. So whether we are still a regional hub for the public sector or not, I don't know. But certainly got large public institutions like Advocates Hospital, things like that, providing healthcare for a tremendously large number of people. So all those things are there and driving the growth and development of Cambridge. On top of that, there's something around the relationship to London as well. Years ago, I met an American, and I was talking about when at that point I lived in Kingston upon Hull. And she said, "Hey, is that anywhere near London?" And it's kind of, well, yeah, I suppose on an American scale, yes, everywhere in the UK is near London, and that sort of thing. But Cambridge, in some ways, she didn't know her geography, and they knew her geography really well, because the Cambridge, other areas, all in the southeast, really are important about their connectivity to London, how they relate to London, how they take some of that growth around London is really, really important. And also, don't underestimate the impact of migration. As people already alluded to, Cambridge is an international city, and it is much the better for it, but migration has a tremendous impact on Cambridge as well. So to confirm what Julian said about local government being about the 19th century, I'm going to go back to the 19th century, which is completely unplanned, but there we go. Back to the days when population pyramids were population pyramids, as you can see. People were born and then people die as they get older, and all that sort of thing. There's a tremendous amount of growth in and around across the whole county. So this is the map of the county, and Cambridge is down the middle bottom, as it were, with the word Cambridge written on it, just in case you're wondering. So there was red areas, tremendous amounts of population growth going on. Tremendous amounts of population growth going around across the county. With what people are saying, we move on then into something around urbanisation, and between 1851 and 1901, again tremendous growth, but centred on urban areas. And again, we've already had reference to the creation of urban slums and that sort of thing. You've got a picture there of one of Cambridge's dark satanic mills. Although that one would have smelled quite sweetly, as it's the old Chivers jam factory. It is actually still there, actually, although in modern form. If you take the guided busway and route up through Histon, that site is still there, though looking somewhat different. So that's again, but you're looking at the urbanisation. Also, some of the things that were going on around enabling all that growth to take place was issues around things like malaria and like public health issues, outbreaks of cholera. This map just shows that Cambridgeshire between 1840 and 1910 was the hotspot, along with Kent, for malaria. The marshes, we had a hotspot for malaria. And we also talked about great public works infrastructure being put into place to overcome things like cholera and a whole range of other things. And if you go down and look at the pumping mill where the Cambridge Museum of Technology is at Cheddar's Lane, that was put in place to stop a tremendous amount of effluent going into the River Cam, to improve public health. Again, that's infrastructure to enable all that development to take place. As you move through the time, go through time. You see the growth continuing, and this is interesting. If you think about what Julian said earlier about the political boundaries of the city, the political boundaries of the city, really as they exist now, were in place by about 1935 and haven't moved or changed since then. Around this time, if you look through some of these historic documents, you see discussions about, how are we going to develop within the city? Should we build on Midsummer Common? The answer at that point was no. We're going to keep Midsummer Common as part of one of the green spaces in Cambridge. But that's there as well. Chunking up through, you've then got local historic growth, and again infrastructure being put in place there to enable all that growth to take place. You're thinking about in the late 70s, 80s, things like the M11 being opened, things like A14 being built, and that way infrastructure being put into place to enable growth. And in terms of the future, you will understand that what the total needs of the area, probably planned growth for the area, will be. Now within the Cambridge sub-region, there's plans for 93,000 homes. To reassure you, that sub-region is quite large, includes the whole of Cambridgeshire. If you come down to the Cambridge area in particular, the plans currently going through examination public at the moment are for upwards of 33,000 homes within South Cambridgeshire and Cambridge City area, really meaning 65,000 more people up to 2031, sort of a doubling again, 50% more population compared to where Cambridge is at the moment. So a tremendous amount for both. I'm getting warned about the time I'm doing, but I'll just crack on a little quicker. As you may know, as soon as all this housing that people require, all these jobs that we want to create, the national economy has gone off a cliff, particularly around 2009. But that, particularly if you're building houses, people literally stopped building houses overnight. What we're doing is, in terms of rebooting the Cambridge economy and rebooting where we're going with the national economy, is all these sort of innovative deals that come together. And Julian mentioned the Cambridge City deal. Now, when this Cambridge City deal was signed, here are some of our councillors. We really hit all our diversity targets with this group, which is great. You think about your Clarksons and say that white men in their 50s are terribly put upon and not influential in the slightest. Here's a group of men in their 50s. Well, I don't know. Our local MP, Julian Puppet, might be south of 50. I don't know. But we really hit our diversity targets with these group of people signing the city deal. But you get the idea. In terms of what the city deal is going to deliver for Cambridge, there's a long list of metrics there. And I talked about the number of higher planned homes, sort of number of apprenticeships and that sort of thing, and the amount of investment. And alongside that, given all the things I said at the start about the pressures, about why we want to create jobs in Cambridge, about 45,000 new jobs. Now the sort of infrastructure we're looking at that point in time is all around putting in sustainable infrastructure, supporting cycling, supporting public transport and that sort of things. That's kind of where all that money's going to be spent. It's not going to be spent predominantly on road building. But that's going to be a tremendous challenge for us to make that expenditure on infrastructure effective in order to unlock that jobs growth. My final thoughts, I think I'm well over my 7 minutes, but my final thoughts, which I'm going to come to, is we've already touched upon the ageing population, and this is a graph illustrating there's going to be tremendous, with the changing of the age structure, there can be tremendous more people, particularly those in the 85 plus age bracket, 131% more older people. Where do they feature in this vision of Cambridge as a vibrant, cool, funky place? Where do they feature in it at the moment? That's the things we hear. As County Council, we've got statutory responsibilities to provide care for older people, care for adults with disabilities and a whole range of other people. How are we going to do that at the same time as growing the economy? These are kind of key questions for us and on our plate. I'll leave it there. Thank you. And,
thanks, Michael. Professor.
I'm going to talk about something that affects every one of us, and that is how we're going to stop all these old people wrecking the National Health Service. I only have one qualification for talking about that. And looking around, that qualification is that almost certainly I'm the oldest person in the room. But although I'm not qualified, I've managed to talk to quite a few real experts, and there are a lot of real experts in Cambridge. So the number of old people poses a big challenge to our economy and particularly to our health and social services. Life expectancy at birth is increasing each day by more than 5 hours. So each day life expectancy is more than 5 hours than it was yesterday. And if one tries to extrapolate 50 years hence, that means that life expectancy would have reached more than 90. Most people would have lived more than 90 by 50 years' time. And looking in the literature, the predictions, by 2037, 1 person in 7 is going to be over 75. So we talk about this room, it means that most of the people over there will be over 75. And what's more, back 2 rows will be suffering from dementia. About a sixth of the over 75s. Now it's being recognised at last by the government that the spend on dementia research is far too low. It's less than a tenth of the spend on cancer research. Cambridge is actually a very important centre for dementia research, and so there's a good chance that 50 years' time dementia will be less of a problem than it is now. But the medics I talk to say it certainly won't have gone away, because the human brain is so complicated, it's very difficult to understand what's going on. But the medics, of course, are very clever at keeping us alive, and that means that as you look in the future, the older people will have a multitude of different medical conditions, and it will be important to keep a proper balance between keeping people alive and keeping them happy. Some of the medics said that their colleagues try too hard to prolong people's lives without explaining to them that their treatment is actually going to make them very miserable. So there's a balance there. Today already, 3/4 of those over 65 have some sort of medical condition, and it's largely their own fault. People need early on in life to eat less, drink less alcohol, not smoke, take exercise, so that in later life they can remain as active and healthy as possible. The direct cost of mental ill health, dementia, obesity, physical inactivity, diabetes, loneliness, and cardiovascular disease is estimated to be £60 billion a year to the economy. So it's not trivial. So there's an urgent need to reduce the burden on the NHS. I've been told that 40% of the people in hospital oughtn't to be there, either because they shouldn't have gone in the first place, or because they should have gone, but they stay too long because there's nowhere else for them to go. And Cambridgeshire is actually taking a lead to try to correct that by integrating the health and social services so that not so much of a strain is put on the health service. Going into hospital is easily the most expensive place that you can be, so if you can keep people out of hospital, that's great. And also, if you're not in hospital, you're almost certainly happier than you would be if you were in hospital. And there is a good prospect, not too long in the future, everybody's condition can be monitored automatically in their homes and as they walk around in the streets, so that they can be given help when they need it. The technology is there, and the big problem is how you're going to handle all the data. It's going to be very important for people to manage their long-term conditions themselves without keeping on having to go to the doctor. And this is going to need research, organisation, investment, and cultural change and education. One of the biggest scandals in the present world is the loneliness of older people. Over half of over 75s live alone, and their only company is television. And this puts an unnecessary burden on the NHS, because if you've got nothing to think about except yourself, much more likely to go to the doctor, if only because you want someone to talk to. And GPs tell me this is actually a real problem. People who don't really need anything from them except someone to talk to. And the old person bus pass is a really good investment for the nation, because by giving people something to do, it stops them thinking about themselves and keeps them out of the clutches of the NHS. It's important to get people out of doors. This means you've got to design residential areas really well to make them easy and attractive. Cafes, seats, green spaces. And the whole community needs to be much more age-friendly, so that nobody who wants help is neglected. And I wonder why the churches are doing more about that. Why are they allowing people to stay and be lonely? Actually, I don't know how much of a problem loneliness is in Cambridge. It's certainly a huge national problem. Another very useful way of helping old people is to get them engaged in voluntary activities. It's good for the community, the things they do, but it's even better for them because it gives them something to stop them thinking about themselves. And it also can help play an important role in keeping alive local facilities that are no longer commercially viable, pubs and shops and so on, libraries. There's a report published just in the last couple of weeks by the government. We need to get new models of employment so that people can go on working into old age. There's no reason why they should need to retire. So even today the NHS faces crisis, partly caused by the number of old people. Things are being done to try to cure that, but they need to be pursued much more vigor. 90% of people, older people, live in their own homes in mainstream housing. And Kirsten's already talked about the need to design the housing so as to make it easier for them to stay there as they become old and frail. And there are lots of simple things that people who build houses could do that don't cost very much, like putting the sockets at the right height instead of on the floor, making sure that windows are low enough so that you can see out if you're in a wheelchair. And for some reason the developers just refuse to think about that, so nag them please. So all this is vital to the UK economy and to the NHS. And there are big opportunities for Cambridge to take a lead here because there's an enormous amount of expertise in Cambridge. So we can be an example to the rest of the country, and it's very important. Thank you.